Hey everyone, welcome to Let's Talk About the POTS Life, your go-to podcast for all things POTS. Whether you're living with POTS or supporting someone who is, this is the place for you.
Welcome back to another episode of Let's Talk About the POTS Life. We have another special guest with us this week to share all about their journey with POTS.
Yeah, this week it's cool because we have a different perspective, not only a POTS patient, but another medical perspective. So I think it'll be cool to share Meredith's story and just to really give a different viewpoint. She's a mom, a physician, so just like what her journey through this whole thing looked like.
Yeah. Thank you guys so much for having me. I'm happy to be here.
Yeah, we're excited to have you.
Yeah, thanks for coming, Meredith. We appreciate it.
Of course.
We can start off with if you want to share a little bit about yourself, and you can lead into the diagnosis of POTS for you.
Yeah, sure. So I am from Cleveland originally. I'm not supposed to talk about that or say that.
Right,
I know,
right.
so we can cut that part out. But I did my medical training here in Pittsburgh and just fell in love with the city. And so ended up moving here and knowing that this is kind of where I wanted to start my family, start my practice. And so I was a practicing pediatrician here for several years. And then actually ended up moving out to California and then coming back to Pittsburgh when I was pregnant with my daughter. And relatively healthy. I really didn't have any medical problems that I was seeing a doctor for. But in February of 2021, I got sick immediately following my second COVID vaccine. And then I just never got better. And so at this point, I had a 4-month-old daughter. I was trying to work. And I was just like, why am I feeling like I have the flu every day? I would wake up in the morning. I'd take my ibuprofen to like help me not feel like I had a fever. I was having a horrible racing heart, so tachycardia, and palpitations with that. And then I also was having really bad joint pain. That was my number one thing, was pain, to the point that some mornings I'd be like crawling to the bathroom because my ankles hurt so bad. And so kind of started me on this path to figuring out what was going on. And as a physician, I felt pretty confident that I was going to be able to fix this really easily,
Right?
like I'm smart, like I should know what this is and figure it out. And unfortunately, as we all know,
Right.
there's no quick fix to all of this. But what ended up happening, I saw so many doctors, kind of really changed my perspective on what it means to be a patient as someone who sees patients in the office, and how I was treated and just my path, my journey to this diagnosis. And eventually I was seen at the Cleveland Clinic where I was diagnosed with POTS. And that is kind of when the switch got flipped on. And I was like, okay, so now I know what I'm dealing with. And I have to start figuring out how I can help myself feel better.
We'll let that Ohio thing slide because
Thank you.
You realize Pittsburgh is where you wanted to be.
Exactly. Right. I'm also not a football fan, like either way. Like I don't care at all. So I have no okay, the Steelers, great. Like I'm on board. Who cares? So it's all good.
I think it's so interesting too, because it is hard when you're sitting in a certain seat or like wearing your physician cap. Like, okay, I know this is what I should look for. But then when the tables are turned and you're on the other side, I think now I have a way better understanding of having more empathy for patients and what that looks like and the frustrations that come along with this diagnosis or trying to be diagnosed. It's hard to put that all together. You're a mom, you just had a baby, you're working. Well, it could just be life stress, but then you really realize how much is falling apart.
Yeah. And I think a few things related to that. One of the most challenging aspects is, okay, so I have all this knowledge, but I still can't fix it, like piece it together. The other part is I kept getting and I'm sure most people with POTS have this similar experience where all my blood work was normal, all the tests I was doing were normal. And, okay, thank God I don't have cancer. Like, that's excellent.
Right.
But also, I don't have an answer. Like, they kept saying, well, this is not XYZ, so we don't know how to help you. And when you have a medical problem that there's no marker for or way to test and diagnose, then it becomes kind of the doctors just sort of wash their hands of you and say, well, it must be psychological or but yeah, I think it's totally shifted my perspective as far as treating patients with pain, treating patients with things where we don't know what's going on, but it's something that's affecting you. So just because there's not like a name for this yet doesn't mean that it's not like a real thing that is happening to you.
It is. And I think Meredith and I have had this conversation just yesterday that hearing somebody just acknowledge what you're going through, that this is real, you are feeling these things, just listening to someone and validating that, I think that can go just such a long way.
For sure. I think validation is a huge part of helping you get on the path to healing. I think kind of without hearing that or without someone acknowledging that what you're going through is a real physical thing in your body, it's really hard to be able to step forward and say, well, I want to help myself get better.
It just is another piece of that puzzle that you need to go to the next step. So after diagnosis, it took a little while until you found the POTS life, right?
Yes. I was like, I got this. You want me to exercise? Well, okay, I can do that. No big deal. Spoiler, I can't do that. So, yeah, that's exactly right. So I initially did the Cleveland Clinic like cardiac rehab program, and they gave me very regimented exercises, which I failed at immediately because I had no accountability. It was just kind of me on my own trying to do those things. I also had early on looked at the CHOP protocol and tried to do some of that stuff on my own. And again, just like failed at it. One, because of no accountability, but also because I think I just wasn't yet on the right set of meds to be able to even physically feel like I was capable of starting a program, an exercise program. But once I kind of figured out the right combination of medicines for me individually, which is like another whole complicating factor of all of this for people, then I was like, okay, now I'm ready. I'm feeling like I'm ready to take the next step and figure out how to do exercise. And I actually had another friend with POTS who was in your program and said, she was like, this is life-changing. I'm feeling better already from like 2 months. And I was like, okay, sign me up. I'm on board. Let's do it. And that's how I found you.
Which is crazy because it's rare to know somebody with POTS. But these two, they both lived in California. Then they both moved back here. They both have POTS. So it was like meant to be, I think, that they both found it.
Meant to be. We joked about there's like something in the water that we were drinking in California. Like something happened. And we like both of us now had POTS. But yeah, I feel really fortunate because you're right. She's the only person locally that I know with POTS. And then because of my journey kind of with a long COVID situation, I've been able online and through friends who have long COVID in other places in the country, been able to talk to people about their POTS and dealing with that post-COVID.
Yeah, I was going to say that's amazing that you had someone in your circle that kind of knew what you were going through already. Was she diagnosed before you, or was it kind of like overlapping?
No, it was overlap. It was very interesting. Her story is really interesting because she was suffering for years. And I think hers was probably post-pregnancy is kind of when things like flared up. But she saw tons of doctors. She had a lot of heart stuff. Nobody knew what was going on. And then I got my diagnosis and I was talking to her. I was like, I think
sounds
you
familiar.
probably have what I had. Like we have the same sort of stuff. And so then she went to her PCP and was like, I want to get tested for this. And then and then her doctor recommended the POTS Life. And then that's how I got plugged in too.
Oh, that's amazing.
It's really cool, and I love having them both, and I think it's cool because being able to relate and then start something at the same time that you can kind of bounce, ideas back and forth or meds or, "Hey, I've tried this and what works and what hasn't worked." But now Meredith is just about ready to graduate. She is in her 12th month, and she's ready for graduation, so we are almost there. She has put in so much work, and I mean, maybe you can talk about what things look like for you in the beginning versus to where they are now. But when you started, right, you never imagined that you would be transitioning to a treadmill.
No, I frequently just have to like pinch myself that my life it looks like what it does right now. Because if you had
Yeah.
asked me a year ago, when I started this program, if I would be able to do the things that I'm doing now, I would have said you're absolutely insane. Like,
Right.
no
No
way.
way.
Yeah. Um, and I was just saying to a friend because I was telling her I was going to talk about the POTS life with you guys, and I was telling her how that first week of getting on the bike and doing the 8 minutes
Yes.
and the straight leg. I remember it a year ago. I remember being like, this is so hard.
So
It
hard.
felt impossible. It felt like I was just pushing through cement and the
Mhm.
straight leg raises. I was like, I can't
Your legs
exercise. Like,
shaking.
right. I was just
Yeah.
wobbly and then like sore after. Just like, there is no way that I'm going to be able to do this. And then, yeah, like now the past few weeks, I've been getting on the treadmill, which is another like something that I couldn't imagine myself doing a year ago. I couldn't have even thought that I would be capable.
And along the way, I say this all the time, it's hard for people to see like the little wins along the way, but someone from the outside can see it or family can see it. I knew she was getting little wins where she was like, you know what? We are going to fly. I am going to take who did you fly to Boston with?
I went with my son. I went with
That's right.
my 1-year-old, and I was like,
Yep.
this seems like a bad idea. Why would I do this? And listen, so did I have hard moments? Definitely.
Right.
But I think that I was confident enough from the physical aspect, from the things I had been doing in our program, that I felt like, you know what, I can step up and do this, and maybe I'll have a flare up afterwards. Maybe
Right.
it will be hard in this way, but I felt confident physically that I could do it. And I think that the only reason why was because I'd been working on this program.
Yes,
So
that's what I tell people along the way. You want them to get little wins. You find standing at the kitchen counter, stirring, making dinner was a little easier. Then Meredith's like, I'm going to do a trip. I'm like, you should do a trip. And what she said is so true that you do expect bumps and it may not be perfect. But the fact that day one, she's like, well, I'm not leaving Pittsburgh. And 6 months in, or I forget when the trip was, but she's like, all right, I can fly to Boston. So I think
yeah,
that's just telling in itself. It's not that your life is perfect, but you're able to do things that you weren't able to do 2 months ago, 6 months ago, a year ago.
exactly. And I also, along the way, kind of set little physical goals for myself in that way. So, like, one of the important things for me that I felt like it was definitely something I couldn't do was push my kid in the stroller
Mhm.
and a walk. And I just was
Right.
like, oh, this is so sad. As a mom, like, I want to be able to take my kid outside on a walk in the stroller.
Mhm.
And
Mhm.
so, right, it took me, I think it was around that like 6-month mark before I felt like that was something I could do. And did I go 3 miles? No, I didn't. Did I go around the block? Yes. But that was a huge win for me because it was something that I really felt like this disease had taken from me.
Mhm.
And it was something important that I wanted to be able to do. And so, kind of just setting myself up to have some of those little checkpoints and wins throughout the way was really important.
And everyone's journey is so much different too. We talked to someone who went to bar all the time and that was the goal for them.
Mhm.
To go to walk around the park or
Yeah.
whatever it is. Everyone's journey is so different. You hit different milestones at different time, kind of depending on so many factors. And that's where it's not that if someone calls Kelsey when life will better. It really is. There's no magic number that like
No.
you're gonna hit month 2, you're gonna love it. Like
Right.
Yeah.
Yeah. I think it's cool too because you get to progress. So yes, she did start at straight leg raises, but now where she is, her life looks totally different. And you could let us know either way, but it's not perfect, right? It's realistic to have ups and downs.
Definitely. I think one of the biggest adjustments in mindset is that this is a chronic disease, a chronic illness. And so unfortunately, this is probably something I'm going to be dealing with for the rest of my life. And so still now, I mean, I am a completely different person physically from when I started. But when I get sick with a virus, I still have a flare up of some of my symptoms. And they are definitely not as bad as they were 3 years ago. And it is hard to feel like some of the gains I had made were maybe set back a little bit. But I do know now, because this has happened to me so many times throughout this past year that I've been sick, that, okay, so I'm going to have to take a week off here because I am sick and I cannot get on the bike and I cannot exercise. And will next week when I try to get back on be harder? Definitely. But I know that I can work through that and then get back to the place where I was before. And so just like kind of having the mindset of, I'm never expecting to be 100% healthy in my life. I think that's just like, it would be wonderful if that could happen, but I don't think that's realistic. And so how do I get myself to be 90%? You know, I'm never going to be 100%, and I can live at 90% and do all the things I want to do. And how do I get myself to that, to be there?
And it's crazy because even now, sitting 4 years out, just yesterday, I was in my phone in the notes, and I came across my notes from 4 years ago, pre-diagnosis. And I'm here reading them out loud to Jenna, who works with me. And I said, oh my gosh, heart rate 150, heart palpitations, because I was trying to track what was going on. I didn't know it was POTS. And it was getting my son out of the bath, had to sit down, came up the stairs, sat at the top of the steps 10 minutes. I mean, things that you don't even realize to now 4 years, what that looks like. So even though she's finishing at the year mark, what I'm very upfront about is, okay, this is lifestyle change. You're not going to sign up for this. And I'm going to say, I'm going to cure you. Not fair, not realistic. So it is a lifestyle change. But where I was even at the end of year 1 and where Meredith is, where she can be at the end of, I'm going into year 4, it's night and day. So those illnesses that come, for sure, they're going to happen. Life stress, she has kids, normal things will happen, but they're not pulling out so many symptoms that they're so down and out like she was before she did anything. So it's really seeing at the end of this year, looking back, be like, wow, look where I came from. And that's hard when you're going through it. And it's realistic to still have tears and frustration. Just remind yourself, wow, look where I came from. And okay, I can have these bumps, but we can also keep going forward.
Yeah, 100%. I also feel like where my body is at now is in such a different state than it was a year ago. And so even the little illness, I was so deconditioned from laying in bed for 3 years or like not able to do anything, that everything knocked me out and put me right back in this horrible pain cycle. And now, a year later, my body is in such a different state that it's capable of handling kind of these little hits. And also just mentally, I'm in a much better place, which is so important because I also had the symptom journal and I, you know, like every day, like ate this, you know, like trying to figure out
2 hours meds, what I felt like. Should I change the time?
Heart rate 140 from going to car, you know, like what exactly 100%. And so I think what I tell people that I'm talking to about this is that you don't know what it's like until you've been in it or gone through it. And so I think that having the mind shift of, okay, look, I was dealing with all of this stuff and most of it is better now. But I don't want to get back to that place mentally, physically. So what can I do? And maybe there's not much that can be done to get all that list taken care of. But if I can take care of a few of them, you know, or like just knowing that I'm going to get sick again, but it's not going to be as bad as it was when I started. Even knowing that is just kind of, it gives you a little bit of the mental boost you need to kind of work through some of the stuff.
The physical part, the emotional part, the mental health part, it all goes together to allow you to be as successful as you can. And sometimes those pieces aren't all even, but trying to balance them. And then I think as your body starts to do what we need it to do, then mentally you're like, okay, I can do this. And then things start to make sense. And that's where you really get to see the improvements.
Yeah, 100%. I think getting the physical confidence to go do certain things in your life that you
Yes.
weren't able to, then mentally that's a huge shift for you. You know, for me, it was just saying, okay, like now I can go on this walk.
Yep.
So like that, my whole
Yep.
world has just opened up, whereas before it wasn't. And that mentally is such a huge deal. So
You have to. And someone just said to me, she's graduated, and she said, sent a message and said, Kels, do you think I would be able to go to a conference for school? And I said, yeah. She goes, I don't know. It's 3 hours away. I said, no, mentally, you need to go. Physically, I know she can go.
yeah,
Mentally, you need to be able to go so you can make those pieces match to feel
Mhm.
confident for something else in the future.
Yeah. It's a little bit like jumping off of a cliff sometimes. It feels
Yeah.
like, you know, like, ooh, like, can I do this?
Can I
And
do
then,
this?
but once you see that you can, then it gives
Makes
you
all
the
the
confidence
difference.
and the mental
Yep.
built boost to say, okay, yeah, like I'm headed towards this path where my life can look more like what I want it to be and what I want to be doing.
Yeah.
And with the Pod Life, you came in with a friend, which is great. But with this program, you get to meet others that are like you, and they can give you that encouragement to, yeah, go to that conference, yeah,
Right.
travel, do those things. I did it, and I was fine. Like I had a hiccup, but it's nice to have someone else, like you said, that can commiserate. Like
Yeah.
I thought I couldn't wash my car, and all of a sudden, 2
I
years later,
can.
I can
You
wash
can
a
do it.
car.
Right.
Yeah. Yeah.
Right.
Exactly.
No, it's so true. Just meeting other people and relating and getting the confidence. Because I say all the time, people can hear it from me, they can hear it from Britt, but relating to others that are also in the same seat as you, I think is so valuable.
Yeah. It's a huge deal. I actually am unique in that. So when I started the program, I think I came like twice, three
Yeah,
times
I know
to in
yeah,
person. I mean, I definitely came the first appointment because I was like, I
yeah,
have to meet you and
yeah.
see what what's this all about. But I've done everything virtually via the app, and it's worked great for me. I think just having kind of the freedom where I know, okay, today's my PT day, but I don't have to go get in the car and kind of, navigate all of that, especially early on when driving like wasn't
Right.
super easy.
Sure.
So it made things really easy for me. And it was like I needed things to be easy,
You need
especially if this was going to work for me.
right, you need all those extra things taken care of and to make easy so you can focus on what is the hardest at the moment.
Yes, exactly. So it's been really great for me, I think. And I mentioned this earlier was the accountability piece or two
Mhm.
things. I mean, one was meeting Kelsey and knowing that you have POTS and have been through this and just kind of our sessions became therapy for me in a way,
Right.
which is great. That's what I needed, especially early on. And then two was the accountability of, okay, if I don't get on the bike, if I don't start doing these exercises and I'm doing this, like
She's gonna know.
she's gonna know. She's gonna ask me or be like,
I'm
"Why
gonna
weren't
be
you
like,
on the app?"
"Hey."
Exactly.
Yeah.
But just, and not even like you. I know truly, like you wouldn't have. It's not a
Yeah,
big
not
deal.
in
You
a
would have been like,
negative way. Yeah.
exactly. But I needed that. I needed someone to be
Right.
like, "How were these past 2 weeks? How did they
Yep.
go? How did you feel?
Yeah.
What was going on?" And so, just having that piece to it, I think, was probably the most important part out of everything.
That's great to hear that, that is something that you don't have to be in Pittsburgh to use the program, to feel connected, to have that accountability. We have people from all over the country
Mhm.
using the Pod Life program. You get connected to folks that you would probably never get to meet in person. And the fact that the program it's accommodating to you, like when you said I was going to travel for the first time and I knew I might take a
Mhm.
week off. The program allows you to do that. Like I'm sick this week or I've got something else going on. I have to take a pause and you can do that. You don't have to continuously move forward if you're just not ready for it.
Yeah,
So,
it's super adjustable. I want it to make sense for your life. It's not realistic to get on this and be like, I'm never going to repeat. I'm never going to have issues.
right.
It's normal to adjust and make it work. We want it to work for your life.
Exactly. Because life happens. And actually,
Yes.
the whole
Sure
point of
does.
this is that like you want to live as you want to get your life back to being semi
Yes.
normal. And
Yes.
so, of course, you're going to go, you want to go on vacation, you want to so like all of that is going to happen. And what was so nice is it's just, okay, well, then if I take this week off, I just go back and repeat. I just go back
Yep.
and do the
Yep.
same thing I was already doing and then see how that feels. So, right. It's so customizable.
If you could, I'm going to ask you the same question I ask everyone at the end. If you could
Yeah.
describe your life with pots now with just one word, what would that be?
I think the word would be hopeful. Think
Oh,
I truly, I mean, at the beginning of all of this, I just really didn't have a lot of hope that I was going to live the life that I wanted. I really felt like I was stuck and physically, mentally, emotionally, just, really beat down. And now I feel really hopeful. I mean, even just hearing, so I'm a year out now, and hearing Kelsey say, and in 4 years, how
Yeah,
the potential for where I could
it
be
is.
is life changing. So I thank you for giving this to
Oh
me.
my gosh. Well, I am lucky that we had you.
Oh,
And it truly is. I didn't know at the end of year 1 what year. I didn't know anybody that was that far out. So yes, it
yeah, I
does
can
get
do it.
better and so much continues to improve as long as you put in that work, and I know Meredith will has done great, and we are so proud of her. I mean, she
Thank
is
you.
that person that I met day 1 to now, she's walking a
Night and
treadmill,
day.
she's
mm,
out with her kid. I guess the takeaway message, there are gonna be bumps. They are manageable symptoms. Yes, POTS is still there, but it's so much better than prior to doing anything, and what her future can look like beyond this is still just so bright and promising.
Yeah. Hopeful for my future for sure
Yes.
because of this.
Yes.
Yeah.
Yes, so much so.
Yeah,
thanks so
definitely.
much. Yeah, thanks so much for joining us today and sharing your story. We truly appreciate it.
Oh, we are so thankful.
Oh, of course. Thank you for having me and thank you for doing what you're doing. Anyone who has POTS, this is the path. This is the path.
This is it.
Truly. It
Oh.
is. It is. Guarantee.
So go ahead and head on over to the podslife.com if you're looking for more information. Hit that subscribe button and follow us for more episodes.
Yes, we can't wait to share more tips, more info, all things POTS, so join us next time.